prior to releasing genetically modified foods in 1994, that was the Flavor Saver tomato, there was already overwhelming evidence that there was problems. In fact, the FDA scientists had warned repeatedly that the process of genetic engineering can create allergens, toxins, new diseases, nutritional problems. If you look at the documents which are available on our website, it talks about increased toxins and increased introduction of new toxins, increased existing toxins, bioaccumulating of toxins from the environment. Even the milk and meat of animals fed GMOs were described as a unique risk because the animals could bioaccumulate toxins, so eating the flesh of an animal could end up having higher levels of toxins than eating the GMO crops. Now, they also had an epidemic in the 1980s of L-tryptophan that was genetically engineered by a Japanese company, Showa KK, and that process of genetic engineering almost certainly created these contaminants in the tryptophan supplements that killed about 100 Americans and caused 5,000 to 10,000 to fall sick. Now, the FDA vehemently denied, just ignored the fact that it was genetically engineered. They've been trying to get tryptophan off the market. Their mandate was to try and eliminate products that were competing with pharmaceuticals. We found that out in a letter, actually, that's posted on our site. And so when tryptophan was, they used this as an excuse to kick out all tryptophan, and then Prozac came in, and they didn't have a natural competitor. So they claimed that it was just generic tryptophan that caused the problem, even though it was only one company's brand, which is crazy because if it was generic tryptophan, it would have been across the board. Well, they reported to Congress that it was a tryptophan problem and never even mentioned the genetic engineering roots of the problem, so they withheld information from Congress. And then we also found out that their own documents later, when they were revealed, showed that they knew that there was a genetic engineering component that they were covering up. So the FDA knew it and ignored it. There was also genetically engineered bovine growth hormone, which they were reviewing in the 90s. That also was approved in 1994. And there was evidence that there was problems there too. I spoke with Richard Burrows, who's a veterinarian who used to work at the FDA, and he was kicked out because he was asking for more tests because it was slowing down the approval process. And when he sued the FDA at the court proceedings, they admitted that they set him up to kick him out, and then they had to bring him back in and never let him work on cows again, which was his specialty. So there was a lot of manipulation. In fact, the White House had told the FDA to promote GMOs, and so they brought in Michael Taylor, Monsanto's former attorney, and under his jurisdiction, GMOs were allowed on the market without any safety studies. Bovine growth hormone was allowed on. In fact, the person who was doing studies for Monsanto on bovine growth hormone switched over to the FDA to run a division that evaluated her own research. And also another PhD who'd been doing contract work for Monsanto on bovine growth hormone became in charge of the review process of bovine growth hormone. So within the regulatory agencies, there was certainly awareness that GMOs were dangerous. In fact, 3 scientists working at working at Monsanto, according to another scientist who used to work at Monsanto, they reviewed the milk from animals fed or injected with bovine growth hormone. They found so much of a cancer-promoting hormone in the milk, these 3 Monsanto scientists refused to drink milk after that, unless it was organic. One bought his own cow. So we have a situation where they knew there were problems. They knew there were generic problems with the technology. They had been demonstrated that there was a widespread epidemic with L-tryptophan, probably related to GMOs. They knew that bovine growth hormone was creating more IGF-1 in the milk, which is linked to cancer. And then they just allowed GMOs on the market. And this was a great travesty. Now, the person in charge of policy, Michael Taylor, who may be responsible for more food-related illnesses and deaths than anyone in human history, became Monsanto's vice president, and now he's the U.S. food safety czar. So we can't rely on our elected officials or their appointees to protect us. Now, since then, there's been more information coming out about GMOs. The FDA completely ignores it. I remember talking to an FDA official at a conference, and I mentioned, there's studies that show genes can transfer to gut bacteria from genetically engineered crops, and there's also a study showing that there might be instability. Once you put the gene in, it might rearrange. And I gave her the citations, and she goes, new information. It's like, lady, it's not supposed to be new for you or protecting us, but she was clueless. According to Gerald Guest, director of the Center for Veterinary Medicine at the FDA, the milk and meat of animals fed GMOs carries unique risks. Now, of course, if toxins bioaccumulate, then that is a clear example of what might go wrong. One thing. So the biotech industry, its leader Monsanto, claimed that Roundup did not bioaccumulate. It was fully water-soluble and just washed out of the body without any problem. Well, recently they discovered glyphosate, the active ingredient in Roundup, in breast milk at concentrations which demonstrate that it in fact bioaccumulates. So it does accumulate in the tissues of mammals, humans, and also in livestock. So that means we may be getting big doses of glyphosate. In fact, if you check the urine of European city dwellers who are not exposed to the spray, many of them have glyphosate in their urine. Where they get it from? Could be from the milk and meat of animals that were fed genetically modified feed, because it's sprayed with Roundup. Now, you also end up with sick animals. Now, Roundup chelates. It binds with minerals, making them unavailable to plants. The animals eat the weak and sick plants, the nutrient-deficient plants, and there's a universal deficiency of certain minerals in U.S. livestock, so the animals become really weak and sick. So we're eating weak and sick plants, weak and sick animals, and that can't be helpful for us. And we get doses of Roundup, which further chelates or binds with minerals, making them unavailable, so we become weak and sick as a result. So this is another way, just the chelation and just the eating of the sick and weak animals and sick and weak plants. Now, there's anecdotal evidence which is pretty compelling when you hear it over and over and over and over again, especially from doctors, and I hear a lot of that. Doctors say they take their patients off of GMOs and they get better from gastrointestinal problems, mood disorders, they have greater energy, less brain fog, reduced allergies, asthma, autoimmune disease, etc., long list. And I've heard one example of a family. They had their own chickens, and they'd buy non-GMO feed, and they would eat the eggs. One morning, both the mother and the daughter had to be rushed to the hospital with anaphylactic shock. They were having an allergic reaction after eating their own eggs that they've been eating every day. So the father called the supplier and said, "Did you send us anything different?" He says, "Yeah, I couldn't get the non-GMO feed, so I sent you GMO feed." So that was the first day they were eating their animal. You know, it's like, is it a coincidence? Can we rely on anecdotal evidence? Well, we live by anecdotal evidence. Moms feed their kids something, the kid reacts to it. That's called anecdotal evidence, but it actually is compelling, especially when you hear it over and over again. I hear people say, I react to conventional milk or eggs, but not to organic. I react to products, in one country and not the other where they're not using it. So there's an indication that's rather strong. They also found DNA of soy and corn in the milk of cows and the milk of goats. And then if you look at all the changes, the physiological changes that occur in animals that are fed GMOs, from the lab animals to the livestock, smaller organs, inflamed organs, potentially precancerous cell growth, damaged sperm cells, damaged pancreas, damaged liver, microvilli messed up in the gut, a whole long list. Infant mortality, etc., etc. So the animals are different, and a study was done demonstrating that the animals are materially different when they've been fed GMOs. So there could be hormonal differences and all these other things that occur in the animals. We eat all those sick and imbalanced animals. Certainly that may have an effect on us. Factory farm animals definitely use genetically engineered crops. In fact, if you look at what's genetically modified, soy, corn, cottonseed, which is used in cotton meal for animals, canola, the meal is used for animals, alfalfa, which is used a lot for dairy, and sugar beet pulp. The majority of the food in factory-fed farming conditions is genetically engineered, and that majority is Roundup Ready, sprayed with Roundup. Now, Dr. Don Huber has been vocal about a particular we'll call it organism, or he called it last a prion-like protein, produced in high quantities in crops that are sprayed with Roundup or glyphosate-based herbicides. And when the animals eat that, it ends up in their digestive tract, in their reproductive tract, and it ends up, according to the research, linked to sterility, to losing their either miscarriages or complete infertility. And they've taken this prion-like protein and applied it and exposed it to a chicken embryo, and it killed the embryo within 24 to 48 hours. And then they were able to re-isolate it, which is important for the scientists to verify that it was in fact the causative agent. And they found that when they switched to non-GMO feed, that this prion-like protein, organism, whatever it is in vastly reduced numbers or non-existent. And they think it's also related to human miscarriages or infertility. They found it in miscarried tissues, etc. So there's that big question mark. Now, anytime something like this comes out, there's a huge concerted effort to hide the evidence and attack and threaten those that find the information. And so it's a slow-going procedure for the research because that's what's underway. So they can't be fully open with all the details because mysteriously a lot of the people that they're working with all of a sudden find that they can't work with them and do the work anymore because they're getting pressure. So it's moving slowly, but it's been found in other countries in their feed. It's been looked at by other scientists in other countries, and it's a big concern. Also, Roundup promotes the growth of fungal-based pathogens. So a lot of these funguses can produce mycotoxins, and there could be mycotoxins in the feed, and that also can affect potentially the animal health as well as human health. So there's a lot going on with this, and I have to say there hasn't been one single published study looking at the health of an animal eating another animal that's been fed GMOs. There was an unpublished study where they indicated there was some physiological changes, but that never came out. There's only 9 genetically modified food crops currently commercialized, but they just approved apples and potatoes, so it could rise to 11. The 9 are soy, corn, cotton, canola, sugar beets, alfalfa, Hawaiian or Chinese papaya, zucchini, and yellow squash. So those are the only 9. And then you have bovine growth hormone, which is genetically engineered in its origins. You have aspartame, which comes from genetically modified bacteria. You have certain microorganisms and enzymes and things that are used as cooking agents, but I think that list will drive people crazy right now, so let's focus on the main crops and the animal products from animals fed GMOs. One of the biggest concerns about GMOs is the fact that once you put it in the environment, it's there. It's part of the gene pool. It cross-pollinates, the seeds transfer. And it's not just cross-pollination, it's accidental mixing, it's human error, it's out there. And so it'll mix with organic, it'll mix with non-GMO. You can find organic products that have small levels of contamination. And then you think about the long-term nature of the gene pool. The only thing that lasts longer than the self-propagating genetic pollution is extinction. These genes will outlast the effects of global warming, they'll outlast the nuclear waste. It becomes a permanent feature as long as the species exists. We have no technology to go in and remove the contaminated corn varieties in Mexico, which is the world's source of the genetic diversity of corn. It's contaminated. And so you'd think that before this was introduced that all doubt would be extinguished because of this permanent nature affecting everyone who eats, all living beings, all future generations. It's exactly the opposite. In a 1999 conference, Monsanto's consultant Arthur Anderson acknowledged that Monsanto's ideal goal and future plans were to genetically engineer 100% of all commercial seeds in the world and patent them, and Anderson created the strategy and tactics to achieve it. And so that plan is only expanded now from the entire biotech industry. It's not just seeds, it's also insects. They've released mosquitoes in 4 countries. They want to release in the United States. They want to introduce fish. There's 3 dozen at least fish in the pipeline waiting to be introduced or approved. They're livestock, trees, fungus, algae, bacteria. They want to replace nature, eliminate the products of the billions of years of evolution, replace it with designer organisms using designer genes designed for greater profit and control. And this is their ideal future that is irreversible. So that means this generation is faced with a choice. Are we going to look at Monsanto's ideal future, and they keep getting wrong about the nature of their products, or maybe they're getting it right and just hiding the fact that it can kill and maim and cause disease, or do we want to propose to hold on to nature and to support the nature of nature? So the contamination issue, the cross-pollination issue, the fact that it's biological, self-propagating genetic pollution, that is very serious. The American Academy of Environmental Medicine looked at the animal feeding studies on GMOs in 2009 and said gastrointestinal problems, immune problems, reproductive problems, organ damage, accelerated aging, problems with cholesterol and insulin regulation. And they said based on the animals, which are stand-in for humans, no human should be eating this, so all the doctors should prescribe non-GMO diets. Thousands of doctors are in fact prescribing non-GMO diets. Now when I go to a lecture, I'll say, okay, I'd like to ask the doctors, let's say, what percentage of you are prescribing non-GMO diets? Oh yeah, okay, so what is the effect that you're getting? What kind of symptoms or diseases or disorders are clearing up? And I'm not a doctor's conference, I'll ask the same kind of thing to the audience. How many of you have switched to non-GMO food and noticed the change? And it's consistent whether it's a doctor's audience or the direct consumers. We hear the number one symptom that cleared up is gastrointestinal of all types. The number two is improved energy and reduced brain fog. Then there's a bunch that are all around the same amount, which is immune system problems of all types, allergies, asthma, autoimmune disease, skin conditions of all types, headaches, including migraines, weight problems, people can lose weight just by switching to non-GMO and doing nothing else, and mental conditions, and also pain, just joint pain, fibromyalgia. Mental conditions like depression, anxiety, and especially among children, out of control, ADHD, autistic symptoms, things like that. Then you have a huge list of things that people raise their hand about that's not as popular, and they're not as popular diseases or disorders. Someone, fatty liver, kidney failure, et cetera, et cetera. So when you look at these type of disorders and diseases and you track them, and see, have they gone up since GMOs were introduced? Yes. Are they going up in parallel with the introduction and expansion of GMOs? Yes. Same with Roundup. Now, that's correlation. It doesn't prove anything. But if you look at the characteristics of the two main toxins found in GMOs, the Roundup herbicide, the Bt toxin, which produces its own insecticide inside the corn, which breaks open the stomach of insects to kill them, and now has been found to break open little holes in human cells. If you look at those two toxins, plus the process of genetic engineering itself, and all the collateral damage that can happen, that can create, that can explain why such a wide variety of diseases and disorders are likely to be influenced. Not just could be, but are likely. When you look at the nature of Roundup itself, Roundup is a probable carcinogen, or its active ingredient glyphosate, according to the World Health Organization. It causes birth defects in animals and almost certainly in humans based on what we've seen in Argentina and other places. It damages the mitochondria, which has a long list of diseases related to that. It creates gut bacteria dysbiosis or imbalance by killing beneficial gut bacteria, but not the negative stuff. That's linked to many diseases. It blocks the ability of the gut bacteria to produce the aromatic amino acids, which are necessary to produce serotonin, melatonin, dopamine. If you have deficiencies in those, now you have the mood, now you have the insomnia, now you have Parkinson's, you have all sorts of things, plus dysregulation of blood sugar and the ability to say, I'm full, I can stop eating. So obesity is thrown into the mix. It can suppress digestive production of enzymes and the ability of the mitochondria to function properly. It's an endocrine disruptor and can shoot up the testosterone in female rats and reduce their estrogen, shoot up the estrogen in male rats and down the testosterone. So it changes the normal gender balance of the hormones because it blocks it interferes with aromatase, which turns estrogen into testosterone. It's all sorts of nasty things, and it also affects what are called CYP enzymes, which are related to vitamin D, and there's a lot of vitamin D deficiency, as well as the ability of the liver to detox other poisons. And so all the other poisons we're exposed to may become amplified in the presence of glyphosate or Roundup. So now you ask me, is it possible that GMOs or Roundup could be related to all of these diseases on the rise, from senile dementia, Alzheimer's, Parkinson's, anemia, schizophrenia, autism, diabetes, all sorts of cancers, etc.? Yes, it absolutely can, and probably does. Because we have this interesting parallel. Same problems in afflicting lab animals, getting better in humans and livestock and pets that are taken off of GMOs, on the rise in the US population in parallel with GMO consumption. And if you look at the biochemistry and physiological changes of the components of those diseases, they would predict it. So I think it's a pretty clear, powerful, and compelling argument And even if we don't have the smoking gun of a randomized double-blind trial with humans, which we may never get, it's enough for a reasonable person, even thousands of physicians, to say absolutely not. Moreover, if you get rid of GMOs and you switch, ideally, 100% organic, because then you get rid of the Roundup, which is being sprayed on many non-GMO products just before harvest, so it's in our food. If you switch to all organic, take notes. Notice what happens. Notice your energy level. Notice your clarity. Notice your sleeping. Notice how, change your whole family. Notice the level of love and appreciation and energy that your family has. Change your dog and your cat and see it all of a sudden get energy again, and realize you don't need a double-blinded randomized trial. You just can live better by switching to a non-GMO all-organic diet. Dr. Stephanie Seneff, an MIT senior researcher, can analyze big data. She sucks data off the internet and organizes it to see relationships. And she's brilliant at it. She's a genius. And she also has a degree in biology, and she's looking at autism. And she could see all the physiological changes in autistic children and can show why they have the particular behavioral symptoms that they do. But she couldn't figure out what was the environmental influence that was causing all of these changes that caused the behavior problems, etc. Until she went to a lecture by Dr. Don Huber, an expert at Roundup. She said to me she sat on the edge of her chair for 2 hours, because everything he said about the chelation, about the endocrine disruption, about the shikimate pathway and the P450 cytochrome pathway, these are technical points that she totally got, fit hand in glove. And she realized this was the missing element, especially given the amount of glyphosate we're exposed to in the United States. Huge, huge amounts. It's found in 60 to 100% of the air samples and rain samples in the Midwest. It's found in drinking water, it's in our blood, it's in our urine, it's in the unborn fetus's blood, it's in our food supply. It's sprayed on our lawns. So she realized that this was the missing link that she'd been looking for, and has published articles linking glyphosate with autism. Now, independent of her, I was interviewing parents of autistic children who said that when they switched to organic, non-GMO foods, they noticed a dramatic improvement in their children. Dramatic improvement. In fact, I'm doing a film right now about a family whose son lost his autistic diagnosis soon after switching to organic food 100%. They tried other things, a lot of other things. Therapy, they went gluten-free and casein-free and whatnot, and noticed some incremental change. But when they switched to 100% organic, whole foods, I interviewed this kid. You'll see the film. So I would say, there was one interesting story I had. I was talking to a mom. She said she had switched her kid to casein-free, gluten-free, and it was about 80% organic, and it was about 80% fixed, 80% back to normal. And she would tell her friends, my kid's 80% back. Oh, really? What do you do? Well, no gluten, no casein, but 80% organic. She said it a few times and realized, wait a minute, 80% better, 80% organic. Oh my God. Switch to 100% organic, close the gap. She said he's virtually perfect, So, again, I don't have studies on autistic children, but I interview pediatricians on camera who say autism is curable. Absolutely, they see it, they do it, and that food is a major component, and GMOs are probably a major engine in the dysfunction and the removal of GMOs and the toxic chemicals on food by switching to organic is a major contributor to their success. It's hard to say which is the component that causes more harm in a GMO crop, Roundup or the process of genetic engineering. If you look at the charts comparing diseases with increased, some of them have been done just with Roundup, some of them have been done with just GMOs, and some with both. Roundup is used in more of those charts because there's a biochemical basis for that potential causality. So I can't tell you which is more dangerous. I can tell you that in Professor Seralini's study in France, they took a group of rats and fed them a little bit of Roundup, far less than what was allowed in the drinking water in Europe or the United States. And then they fed them natural corn. They fed another group Roundup-ready corn, but had never been sprayed with Roundup. Another group that had Roundup-ready corn that had been sprayed with Roundup, which is normally what happens. All three groups got multiple massive tumors, early death, and organ damage. All three groups, whether it was Roundup, the corn, or both, they all, compared to the controls, had far more tumors, died earlier, and in larger numbers, and had problems with the liver, kidney, and pituitary. So, which is worse? You know, pick your poisons. There's not enough data for me to say what a safe level is. But there's enough experience to say that individuals have different reactions. Even the same family, you know, in the film I'm doing now, there's 21 chronic conditions between 5 members of the family. And they all were different. You know, eczema, allergies, depression, autism. I mean, it's like the same underlying cause can be expressed in different physiologies, even in the same family, differently. And I talked to people, you know, originally when people told me that they reacted to GMOs, I did not believe them. Here I was going around the world, literally, talking about the documented health risks of genetically engineered foods according to all these animal studies and the theoretical research. But I thought it was going to be some kind of lightweight background trend that you could probably catch with an epidemiological evaluation. But I wasn't expecting people to say, I am reactive. And then I started talking to doctors, completely changed my thinking. This allergist said, my patients are more allergic to GMOs than non-GMOs. Or when I get rid of my patients' GMOs, they all get better. And I said, wait a minute. They all get better? What percentage? I said, 100%. Went, let me go in and talk to your patients. So I went into that. I started speaking to the patients at these doctors' clinics, listened to their history, and I was blown away. And at the same time, I visited the farms and talked to the farmers and veterinarians who had taken the livestock off of GMOs, and I was hearing the same stories. You know, whether it was the pigs or the cows, you know, the pigs no longer having diarrhea, the people in the doctor's office no longer having, you know, irritable bowel or Crohn's symptoms. Same story. Same story. And then I started to ask audiences. And now I've heard it from thousands of people. The same stories. So now I'm a believer but the thing is, you know, I'll ask the audience, how many of you have switched to non-GMO food? And maybe 70 raised their hand. How many of you noticed an improvement in your health? Maybe 50 raised their hand. 20 didn't raise their hand. Maybe they were already healthy. Maybe they didn't get healthier. It's all individual. In my film, Genetic Roulette, I have 6 case studies of farmers and, you know, basically animal experiences of people switching animals to non-GMO and noticing an improvement. My friend Im Pedersen from Denmark switched his pigs to non-GMO soy. He had to pay more for the non-GMO soy. He's still making $112 more per pig because there's lower death rate, higher conception rate, higher litter size, two-thirds less medicines, etc. And these are repeatable. The same thing with a western Iowa producer, 75% reduction in medicine use. I went to one village in India where they were allowing their animals, their buffalo, to graze on cotton plants after harvest. They would just bring the animals into the field and they'd eat the cotton plants. They did that for 8 years. Well, they allowed their animals to graze on genetically modified BT cotton plants after harvest for 1 day. Within 2 or 3 days, all 13 buffalo had died. They lost 26 goats and sheep. I visited that village. I talked to them. In South Africa, there was a guy that had tremendous problems with the health of his dairy cows and his pigs. The production of milk was very low. The animals were sick. Some of his pigs were like cannibalistic. They would bite the tails and ears of their neighboring pigs, and it was pretty horrible. And he asked a veterinarian in the United States what to do, and he said, don't feed them another GMO. He took them off of GMOs. They got better and ran out of the non-GMO corn he was producing, had to buy GMO corn from the field, from the marketplace. They all got sick again until he was able to plant enough non-GMO corn for year-round non-GMO consumption. Now, what was interesting and tragic about the story was the fact that his farm workers, he had 60 farm workers, laborers. He only needed 50, but he had to get 20% more hired because so many were sick. Terrible sickness. He had inflammatory issues, flu-like symptoms, massive headaches. He said once or twice a month, he'd be talking to a worker and their eyes would all of a sudden move in separate tracks. And he knew, based on experience, within a day or two they'd be dead. So he had a huge death rate on his farm, and he had no idea why. In South Africa, most people eat corn every single meal. And they were eating the corn grown on the farm, which was 100% GMO. So this group may have been eating more GMOs than anyone in the world, except maybe other South African farms. And they were dying and having tremendous sickness until he grew the non-GMO corn for his animals, and the farm workers got better until he ran out and had to buy the GM corn from the marketplace, and they got sick until he had 100% non-GMO corn. So in the same change, with and without GMOs, the animals and the workers were either sick on GMO corn or healthy on non-GMO corn. So this tragic story is really like the canary in the coal mine. The people that we, bless them, they were the ones that were exposed far greater than us and showed us what we need to see. Well, you might be in the mood for some good news at this point, and I'll give you some great news. We're actually winning. We're winning the battle. And it's not a battle that I'm personally waging at the level of policy, because I've seen the Obama administration march lockstep with Monsanto. They're worse on GMOs than the Bush administration. I've seen how the power of Monsanto has been there to co-opt state governments and whatnot. But that's not where the battle is being fought. In Europe, there was a high-profile food safety scandal about GMOs that erupted on February 16th, 1999, when the gag order on Dr. Arpad Pusztai was lifted. I talk about this in my book, Seeds of Deception. In fact, I opened the book with this story, how Arpad's wife answered the door and there was all these reporters standing in front of her, and they were trying to come into the house. She says, "But we can't talk, we would be sued. It's okay now, they released your husband, he can speak." And sure enough, his gag order was lifted on February 16th. After 7 months, he was unable to speak during those 7 months. He was basically, the subject of a disinformation campaign to destroy his reputation, to protect GMOs, because he had smoking gun information. And 700 articles, more than that, were written in the UK within a month of that lifting of the gag order. Within 10 weeks, the tipping point of consumer rejection was achieved. On a particular day, April 27th, 1999, Unilever, Britain's largest food maker, said, "No more GMOs in Europe." Next day, Nestle's, "No more GMOs." Then Marks and Spencer and this thing and this thing. The rest of them, no more GMOs because of consumer education. Tipping point. That's what we're seeing happening in the United States. A tipping point has occurred against GMOs in the natural products industry, and now it's underway in the conventional food industry. Cheerios main brand, non-GMO. Grape Nuts, another cereal, non-GMO. Hershey's becoming non-GMO. Target home brands. These are mainstream items. Ben & Jerry's, I can't believe it's not butter. Smart Balance. These are not organic products. These are in Walmart, okay? So we have a master plan to eliminate GMOs within 5 years. We're raising money for that. So if anyone out there wants to give us money, we know where to spend it. We know exactly what to say, how to say it, who to say it to drive the Walmart shopper, the mom, the pet owner, the sick person, the healthcare practitioner, the religious person, the particular demographic groups that we know are receptive to this message, to drive them to the non-GMO labeled product. And once we show that swing in market share, without any confusion, this is why Grape Nuts is going up, this is why Hershey's is going up. When that becomes absolutely clear, then we have a tipping point in the United States, just like we had in Europe. So we expect that to happen within 3 years, and animal feed within 5 years. So I can name the companies that are not switching, like Kraft, like Nestle's, but they might be quietly switching. They may be secretly looking at non-GMO products and non-GMO product lines. I've heard some rumors about some major companies that are switching. Can't say the names yet. So I think every single mainstream supplier is already looking at this. It's been a major discussion. There was discussion, it was in a major article in Fortune this week, the war on big food. They're not only aware that it's the GMO issue, but it's also the artificial ingredients, et cetera, et cetera. But GMO is leading the pack. Hain Celestial, which is a $2 billion company from the natural products industry, just came out with an article saying they're being wooed to fill up the shelves of mainstream supermarkets that are looking for, yes, organic, yes, natural, but primarily non-GMO attributes. Because 40% of Americans say they're avoiding or reducing GMOs. And even if that's not that number that's actually doing it, it's popular. It's up from 15% in 2007. 75% of Americans as of 2013 were concerned about GMOs, according to the New York Times poll, and most of that was because of the health danger. 61% of Americans were concerned about their personal health eating GMOs, especially moms about their kids. So we now have the evidence circulating in enough minds in the United States so that any aware and awake company is paying attention and starting the process of cleaning out GMOs. Although there's only 9 genetically modified food crops, the derivatives are found in maybe 9 out of 10 packaged foods, because you have soy lecithin, soy protein, corn syrup, sugar from sugar beets, and then the oils, soy, corn, cottonseed, or canola. So if it's in the middle of a supermarket and it's in a package, it probably contains some derivative of GMOs. If you put all the corn together that people eat in the United States, it's like 160 pounds a year. So people eat a lot of genetically modified corn in aggregate. If you're trying to avoid GMOs and you go to the produce section, hardly anything in the produce section is genetically engineered. You get corn, zucchini, yellow squash, papaya, and edamame, soy. That's it. Nothing else in the produce section yet. There's apples and potatoes on the horizon, and hopefully they'll never get marketed. But it sort of depends on how you eat. If you buy packaged foods and you go to fast food restaurants, you're eating at every meal. If you cook from scratch, depending on the cooking oil, you might be doing very well. Europe mercifully has labeling. So if anyone intentionally uses GMOs, it's labeled. If someone accidentally has contamination of 0.9% for any ingredients, it's supposed to be labeled. The enforcement's not great in Europe, but the commitment by the food companies has been great, so that I don't think there's a lot of companies intentionally putting GMOs on the market, and the contamination is usually fairly low. Unfortunately, the big loophole in Europe is animal feed. You don't get products that are like milk and meat and eggs. They're not labeled as from animals fed GMOs. That's a huge loophole, and that's something that consumers there demand but are not getting. And because of that, the amount of animal feed that's genetically engineered is more than 50% for European meat products. In the United States, the FDA has been told for decades by the White House, promote GMOs. So they're actually mandated to promote GMOs. It's actually part of the PowerPoint, the official PowerPoint, at least a few years ago by the Deputy Commissioner of the FDA. So they ignore the desire of 9 out of 10 Americans who want labeling to promote the economic interests of 6 GMO companies by avoiding labeling, because they know most Americans say they would avoid GMOs if labeled, and that would be bad for business. So they're ignoring the human rights, the rights of parents to feed their kids what they want to feed in order to promote the bottom line of Monsanto. There's a fiercely pitched battle raging around the world, and a lot of countries have schizophrenic personalities about it, where one group is in favor, one group is against, and the group that's in favor is largely controlled or manipulated by the biotech industry in a big way. I was just in Ecuador last week, and for example, their constitution says no planting of GMOs, and if the president says it's okay for national security, they'll allow it. Now, as soon as that came out, they were attacked. You know, you can look at WikiLeaks, and it shows that the U.S. government was planning to undermine their constitution. So the State Department paid for reporters from Ecuador to go to the U.S. to be trained by Monsanto how to report on GMOs. Sure enough, their articles came out with Monsanto's talking points. All of it were lies. You know, nothing doesn't feed the world, does not increase yield, does not reduce agricultural chemicals. is not proven safe, but that was lost on these trained reporters. Then a private individual flew the president and his cabinet to the United States, trained them on GMOs, and he came back saying, biotechnology can increase yields by 400%. So in India, for example, you have certain state governments that have kicked Monsanto out or don't want to plant GMOs, and you have the federal government moving forward with field trials. You have the Supreme Court, which asked scientists, PM Bhargava, to go on the approval committee and take a look and see if it was accurate. He said it's a complete sham. They don't look at anything that's relevant. They should be immediate moratorium on GMOs because they're not being evaluated. The Supreme Court gets that information, sits on it, doesn't do anything for years, and allows the current government to go ahead with field trials. China, you have a general, a retired general, puts out an article saying, have you seen the increased disease rate in China correlated with the increased import of genetically modified soy used for soybean oil? Could it be related? I think it is. 2 days later, the army bans foods that's genetically engineered for its soldiers. And yet the government is trying to convince, has a budget now, to convince the people that GMOs are okay, because they said they delayed, the leaked document said they delayed the approval of a genetically engineered soybean variety because of public concern. So it's like everywhere you have these two factions. I was in Vietnam. Part of the government was very concerned and brought me there. Part of the government was basically marching lockstep with Monsanto. The same company that brought them Agent Orange is now giving them Roundup-ready crops, and Roundup is also linked to birth defects. So it's like the getting people to act against their best interest is the incredible success story of the biotech industry. I was in Australia. Now, Australia's canola had traditionally sold at a discount below Canada. Canada introduced genetically modified canola. Europe shut its markets. Canada's canola started selling below Australia. So Australia's was selling at a premium. Then some state ministers of agriculture had the bright idea of lifting the moratorium, convinced that it would, quote, help the farmers. Brainless. And sure enough, the GM canola that was starting to grow sold at a discount below the non-GM. The two major sellers of canola in Australia refused to touch it. There's mounds of canola that have been sitting on the ground for years. It's a disaster there. Japan shut its doors. This is what we predicted. I was actually on tour in Australia, and those agriculture ministers that let me in the door, they heard it. They kept the moratorium. They were ready to listen. Those that had decided that they were going to lift the moratorium, they never wanted to meet with me. 3 weeks after I left, they lifted the moratorium without ever hearing the truth, without ever hearing the accurate prediction that GMOs would not protect and save and help the industry, but would work against it. One of the ways that the biotech industry and transnational corporations in general try and overcome state and national laws is through trade agreements and treaties. The World Trade Organization is an example. George Bush, the second one, sued Europe, claiming that its delayed approvals of GMOs was a trade barrier, and the WTO agreed, forcing the hand of the European Commission to speed up their approval or denial process of GMOs. So now they're using, or they plan to use TTIP. See, TTIP has, as part of its structure, it's not just a trade deal, it actually is designed to meddle in domestic law. So it gives investors, companies, the ability to sue countries if their laws cost them money. Now, previous trade deals have allowed, for example, a successful challenge against the United States companies that were saying dolphin-free tuna. The nets that were used to gather the tuna fish were not killing the dolphins. They wanted consumers to know that, and that became illegal because of the trade dispute. So now they can't tell U.S. consumers, and so the killing of dolphins has increased as a result. More recently, the country of origin label has been declared illegal in the United States, and so the Secretary of Agriculture has informed the Congress that it's illegal and need to repeal it. So this is the way that other countries or companies can attack U.S. laws and vice versa, forcing them to change because the laws can reduce the sales of their products, even if the laws uphold basic human rights for decision, or environmental issues, or humane issues. So these investor-state trade disputes they're organized like tribunals of 3 lawyers from the corporations. They go on a rotating level. So the corporations, their lawyers, decide who wins in closed proceedings. So imagine that we pass the TTIP and a company from Europe says, you have a non-GMO label on your product. Well, my product contains GMOs and I'm suffering because I'm not selling as much. And there's no scientific basis for you to put non-GMO that's meaningful or relevant to this discussion. So it could challenge even voluntary, let alone required mandatory labeling of products that say GMO. So it is a way to completely destroy democracy and sovereignty at the same time and hand the keys to the kingdom over to the transnational corporations on GMOs and all sorts of policy. So it's a very devious, mad scientist kind of brilliant way of exercising their power over sovereign states, and hopefully we will stop it and never let it show its ugly head. The question to feed the world was presented to the ISTAD report, sponsored by the United Nations and the World Trade Organization and many others. More than 400 scientists got together for years and determined, among other things, that GMOs have nothing to offer to feed the world, etc. In fact, GMOs on average reduce yield. They concentrate the power of agriculture into the hands of a few transnational corporations. Their specific technologies works against a biodiverse agriculture. In fact, the ISTAD report promoted agroecology, using the nature of nature and biodiversity and local conditions to support the farmer, the field, the environment, etc. And under proper conditions, agroecology can increase yields by 100%, sometimes 200%. Compare that to GMOs, which on average reduces yield. So the concept that GMOs are needed to feed the world is really a public relations talking point. It was produced by Monsanto's team when Europe said that they were rejecting GMOs. So they said, we're going to feed the world. And at the same time, just when that came out, there was a meeting of representatives from developing countries that was going on, and they wrote a response saying, don't use us to try and sell your products. So the developing countries don't agree, the experts don't agree, but they've spent a fortune trying to convince people. In fact, back in the late 90s, a group of GMO companies committed $50 million a year for 5 years in their promotion program, primarily to tell people that it was needed to feed the world, so that we should just bite our tongues and go for it. When you hear about the GMO issue, people react in different ways. They get angry, sad, fearful, and I welcome anyone's reaction, but I also make a recommendation. Take the energy in those emotions and convert it. Use your inner alchemy to convert it so that instead of feeling like a victim, you feel like a victor. So that you choose what you call food, as opposed to an FSO, a food-shaped object. You choose what you're going to put in your mouth and not have it determined for you by the biotech industry or their enforcement wing at the Washington, the FDA, so that you can take your food back. And by doing so, realize that it is a sovereign act with powerful repercussions. Because collectively, by making these choices, we are actually dictating to the market where the food companies are going to make their money. And that's actually how we're going to win. And this shows that in this case, where the transnational corporations have completely corrupted logic and policy to give us food that is not in our best interest, we are able to take it back. And we can support the organic and agroecological food chain. We can support healthy eating. We can share this information with others. We have a lot of information on our website, responsibletechnology.org. We have a speaker training program, a tipping point network. We have films and articles, etc. We have a way of empowering and educating people. And this, we are finding, actually is changing people's attitudes on a whole bunch of things. Because Corporations have taken over a lot of areas of our lives, and sometimes it seems like it's impenetrable. But we start here, and it turns out it's totally penetrable, it's totally winnable, we are winning. And it's so intimate to us, it's what we feed ourselves and our children. So this is a way not only to take back our power, but to change our attitude in terms of the kind of universal oppression which is coming out through energy policy and health policy and agriculture policy and all these different policies that are often dictated by the companies themselves and not by common sense. So this is an opportunity for a revolution, starting in our kitchen, starting on our plate, that can spread in our minds, to the environment, to the world. I have two main recommendations: eating and speaking. Eat healthy. Non-GMO for sure, organic whenever possible. Because even if you go non-GMO, you still might be eating products that have been sprayed with Roundup and other nasty chemicals. You're going to feel better probably. You're going to notice changes, especially if it's your whole family changing. Talk about it. Share the information with others, with people you love. Tweet it, Facebook it, email it, get it out there.